Unveiling the mysteries of evolution. Ever wondered how it could be retraced to its genesis? This is the journey of manna, redefining truth as we discovered it. From the hustle bustle of the city of Bangalore, we move to the more serious and serene research facility of Necton Labs. Here, under the able guidance of Dr. Sunita Agarwal, stems forth the decoding of human aging and disease processes. Adult differentiated cells made to walk the path backwards through the addition of manna. We call it the manna effect.
The main reason I think I went into this is because I have a very huge probing. I need to know the whys of a lot of things. And even more important than that was I can't get myself to tell a patient nothing can be done. Okay, you're blind, go home, or you're in pain. That feeling is intense. I need to be able to give some answers. I need to give at least some hope, even if I don't have the answers. That hope itself can make a human being survive the greatest of ordeals. And that hope is what kept me searching for something newer on the horizon. And that's what put me on this game plan.
Mana is derived from the Polynesian language meaning magic potion. It is also taken from the Hebrew dialect meaning food from the god, and in the well-known Indian language Tamil it is called respect. So are the diverse dialects from which mana is derived from, and so are the diverse beneficial aspects of mana which we will discuss. Our center here in Bangalore has done a lot of research on mana, which is basically a placental extract from the human afterbirth. Placental extracts are known to have a lot of beneficial materials in them, namely hormones, immunoglobulins, and certain essential minerals, which forms the basic progenitor for various cells in the human body. We are surrounded by a plasma of mana, in the natural sense, the placenta here. At our center, we did this research on mana on different kinds of patients suffering from different kinds of conditions, and most of them in the terminal stages where nothing much could be achieved by the allopathy medicine. These are the patients for whom mana seems to have helped in the long run. Our center has done mana research on two different categories, namely non-ophthalmic and ophthalmic.
जब ये अटैक मुझको हुआ 2 महीने पहले, तब मैं अपना सब आशा खो चुकी थी। I failed in everything. मद्रास में चेकअप भी आई, बेंगलुरु अस्पताल, और उधर डॉक्टर लोग बोले कुछ भी नहीं हो सकता है, सिर्फ 5% हो गए, तो मैं तो पूरी तरफ से फेल हो गई, मुझको लाइफ का वो भी खत्म हो गया।
I am since from 2004. I was suffering from one large mass on my right kidney, which was malignant in nature. I was operated in the month of April 2004 at Kadva Hospital. It was removed, but later on it again recurred. It is spreading like anything. Now it is infiltrated in liver also. Then when I shown at Manipur Hospital, doctor advised me not to go for any operation because it is life threatening and anything can happen on the operation table.
You see, I am from Davangere. In an accident, I become HIV positive in 2001. After coming to know that I was very depressed and I was the only earning member of the family. I could not take care of my family and very depressed. Since then, I was taking this homeopathic and all other available treatments. There was no hope.
The biggest advantage that I have towards this is that I'm a clinician first, scientist second, and I'm an ophthalmologist and a microsurgical surgeon. Using these three paramount important phenomenon, I was able to probe into the secrets of the human existence at a much more minute level. And you would find a scientist in a laboratory working on a different parameter. You'd find a clinician maybe using the scientific knowledge on a different parameter. But here, using microsurgical techniques gave it that beautiful importance that I could really see cells. I'm in any case operating every day on thousands of patients at nanometers and micron levels. Going into it on a dissection level wasn't that difficult. All I needed to do was use these same techniques, those same microscopes, those same surgical instruments at a much more minute level that I was able to dissect out and get out the actual juice of what we're looking at. And that's the way this thing was called manna, as nectar or food from the heavens. That's exactly how it just dropped into our hands as we went and continued into the probe and probing of the human existence.
जब मैं यहाँ आई और यहाँ एक नई कोशिश जो डॉक्टर लोग करने का चाह रखते हैं, इसीलिए मैं इसको करने के लिए तैयार हो गई.
Under the ophthalmic group, we have treated patients with retinal degenerations, namely retinitis pigmentosa, otherwise called night blindness, age-related macular degeneration, and nerve degenerations, optic nerve atrophy. And in the non-ophthalmic group, the major chunk comes from the diabetic patients, hypertensive patients, patients with degenerations of the joints, namely osteoarthritis, certain conditions of the brain like Parkinsonism and Alzheimer's disease.
अस्पताल ने मुझको बहुत हेल्प किया हर तरफ से. सबों को व्यवहार बहुत अच्छा रहा मेरे संग. सभी ने मुझको एनकरेज किया और उससे मेरी थोड़ी आशा बढ़ी. मैं यहाँ आई तो मेरी आँख सिर्फ ऐसा आधा दिखता था, पर आज इलाज के बाद मैं यहाँ तक देख सकती हूँ. इसलिए चेंज तो आया है कहीं ना कहीं. हाँ, उससे मेरी आशा और बढ़ गई और उसके लिए जो कुछ भी डॉक्टर कहेंगे ऐसा करो या कुछ और करो, मैं ज़रूर करूँगी. और आप सबसे ये कहना चाहती हूँ कि जीवन को में जो होप है उसको मत खत्म होने दीजिए.
After the treatment of mana injections, the pain has been considerably reduced, and moreover I am getting good sleep. Appetite also is good. Previously I was unable to walk some distance, now I can walk freely. Previously I was unable to sit also, now I can sit properly also for 10 to 15 minutes. It is a good symbol of improvement.
In January, I came to know about this center and about the mana injections. I started from about 6 months. I was continuously taking this injection. Now I feel better and I have some hope. And this Dr. Agarwal Hospital and so Dr. Sunita Agarwal filled a lot of hope in me. And the recent lab report also shows that there is a lot of improvement in my blood count that CD4 and CD8. So after coming to know about this lab report, so a lot of hope has been filled in. Lot of hope has come in on me, and I can take care of my family. I can live longer. So I thanks for this center, and particularly Dr. Sunita Agarwal, who invented this.
The improvement that we have noticed in both these groups have been tremendous, in the sense the patients subjectively feel there is a gross improvement in their non-curable ailment, which they could not be treated by either allopathy or homeopathy. So Mana is considered by most of these patients as the cure for the end stages.
Scientific analysis goes hand in glove with statistical data. Here, you see a wide array of patients in their before and after comorbid conditions, showing a significant enhancement in their objective clinical values. In spite of the fact that the acceptance of Mana is a paradigm shift varying from one to the other.
My name is Sarthak. I am studying in 8th standard.
How old are you, sir?
I'm 14 years.
For what reason have you come to our hospital?
To get cured of muscular dystrophy.
What is this muscular dystrophy?
It's a problem that
The muscle.
weakens your muscles.
Okay. When did you get to know about this condition?
When I was
4 years old. You got to know about this condition. So what did the doctors tell you about this condition? What is
that it can't be cured.
this muscle dystrophy is a disease cannot be cured?
This is one of the reasons why it affected me, that we had the best of science, the best of knowledge in our hands where ophthalmology was concerned. And then the patient, just some relative comes and says, oh, the patient is in some dying hospital or is in such gross pain because of cancer or diabetes or so many other debilitating diseases, that it felt like I was helpless. I was helpless, like we did a wonderful surgery, the vision was great, and now he's in a heart hospital with a heart attack. Why? Why did God do all these things? And that why just kept troubling me and troubling me. That could we do something about it? Isn't there some way that our science, our technology can reach out to a greater magnitude of people? Isn't there some way that human beings could have a dignity, could have pain-free existence? Anybody in the last stage of their life during death doesn't have dignity. The dignity of life seems to be ebbing away. He's lived this life as a lion, as roaring down the streets, and suddenly it's all just gone. He's in a hospital, there are tubes all over him, he's in pain, and what are we doing? We're just standing and watching. We can't do nothing. Even right now, I don't think we really can do so much. We can make his end a little better. We can make, first thing, life lived with dignity to end with dignity, and life to live without pain. Pain is the grossest of human emotions, and then it just kills that person. He wants to die even if he just can't die.
So when you were started with this Mana treatment, what are the changes that you noticed?
That I can lift my hands more better, and I can get up from the bed more better.
And about your heels, can you stand up after taking this Mana treatment? Are you able to stand up?
But I need some help from people.
It is much better than before you started the Mana treatment.
Before, when people hold it, I could not stand for that.
So now with little help you can stand up and walk on your own.
Walking is not possible.
Yeah, but we thought nothing means we had given up hopes. But after Mana treatment, I feel we have got some positive feeling that definitely something is going to happen. and he will be able to walk in future.
Actually, I had an ocular problem in my right eye due to injury. Many years back, I had gone for operation. But after operation, I got lots of problem in my right eye. I was getting pain, watering, and lots of things. Even every time, it was irritating my eye. Whenever I was going to sunlight, it was irritating me lots and lots. And that was the main reason. That's why I came in this hospital. And even when I had gone for injury, so actually after operation, I was not able to talk to anyone. I was not feeling very confident. Because whenever I was talking with eye contact to someone, I was feeling very, very bad.
What treatment have you taken?
After coming here, I found out this very good hospitals, and I got Mana injections. And really, I want to say that this very nice injections. After taking this injection, now you can see that I don't have any problem. Almost all of my problem has gone, and now I don't have any watering problem, no pain, nothing at all. Even after operation, my cornea was almost damaged, and it was not good, and it was becoming a little bit white. But after taking these injections, really it's good. Now it's becoming very, very black, and even now I am very confident to talk to anyone. And this is making my life very nice. And even I want to say that last month I just got married due to this only, because now I am feeling very confident. I want to say only one thing: Mana injection is very nice. You believe it or not.
Congratulations on your wedding. Thank you very much for sharing your experience.
Thanks a lot, sir.
The samples we receive are put through a strict quality control. They are usually screened for HIV 1 and 2, hepatitis B, hepatitis A, hepatitis C, and we also screen them for VDRL, for syphilis, and most of the organ transplant and blood transmissible diseases. There are a few diseases that we can screen, like Creutzfeldt-Jakob, but there are no tests that we can do for those kind of diseases. Basically, the test that they do at blood banks is what we do at our center. In addition, we do an ASO titer to rule out streptococcal infections, people who might have sore throats. These kind of diseases can cause a problem in future. Also, we do a CRP, though it's not that significant. It can be positive in alcoholics and smokers. But we still do a screening because we don't want our patients to come back to us with any kind of illness after taking our Mana treatment. And after we go through the serological testing, we put them through a microbiological screening also. We rule out protozoal infections, viral infections, fungal infections, and of course bacterial. We also put the sample on a culture plate, and we never use these samples for at least 24 hours till our results come out. After that, we do viability testing because we like to see how good the sample is and how effective the cells can be for our patients. When we had this Mana, it kind of just dropped into our hands. It was literally food from the heavens or a magic potion. Because when we started using this, I remember vividly there's this lady, it changed their lives, it changed our lives. And she had pock marks, smallpox, and these marks don't leave you. They're there on your face forever and ever and ever. You die with it, but you just don't leave you. We were treating her for corneal blindness. 6 months down the road, we find that her pock marks are gone. She has little pigmentation, but there is no more those nice deep marks that she had. We used it on a patient with injury. His eyeball was slashed open. He comes back a week later, eye is healed, the eye is actually seeing. I thought he would never see again in his life. It was phenomenal, and the guy is beaming. There's a glow in his face. The first few experiments that I needed to get done was, even till today, our quality control is so tight that every time a batch is made, one amongst us uses our own bodies as guinea pigs to make sure everything is okay. And this was even more exemplified when we did it the first time. The first injections were taken by my father, my husband, myself, and this is how we were able to understand that there is something absolutely magical. It can change our lives, it can change your lives. I mean, we need to give hope. We need to give hope that anybody needing treatment at any point of time, wanting to have that treatment, it's there. It's there for you to use it.
This is the phase contrast enigma of the mana effect being unveiled to the human eyes, we think, for the first time in the whole cosmic existence. What we see here are cells that have spicular appearance on the cell membrane, dancing between life and death, varied structure and monochromatic luster. Lo, behold, we add mana and it's a virtual abracadabra. Life revisited, these cells come alive with the colors of the rainbow. In front of our eyes, the cells change their shape, becoming uniform and spherical round. In front of our eyes, the cells lose their capacity to create an immune reaction by losing the spicular appearance on their cell wall. In front of our eyes, the aura of cellular energy comes alive. In front of our eyes, the cell exudes the Vibgyor, red for nucleus beaming outwards into yellow, green and blue on the cell surface. Thus is the power of mana. This is the mana effect.
You've been taking treatment from us for quite some time now.
Yeah.
What prompted you to come here?
You know, I had came to the hospital, doctor was for my cataract operation. And just met Dr. Sunita and other doctors and I could done the cataract operation and when I get it done, then seriously understand that the mana, serum has been developed here by doctors in this hospital. This can regenerate my body because I'm 60 plus 61, I feel some weakness in my body and some in my other organs like say the facial and feeling and just some sort of what you call just tiredness. So but I want to continue my youth use, my working in Bangalore in South India for times to come. So when I understand it can regenerate my body, I take this full course advised by doctors and after completing it is surprising for me. The few stand in my hair is coming blackening. If bunch of I think I consider as a I'm not mistaken. I just verified from my wife also. She knows it is newly coming. And this symptom perhaps not perhaps but sure because my hair started graying 40 years back. So this is a new thing. And second thing is I was addicted to tobacco, pan, chewing since a long time. I just left it in 10 years back. Even that there was after effect in my tongue. You understand? And I was trying to how to get it over it is my tongue, but I did not discuss doctor. But still I am by my common sense that maybe due to vitamin B12 or like this one is to get depreciated in my liver. So I taken a lot of vitamin B12 courses, but even after some time, any moment it can harden. But surprising 1 month I am not noticing it. Nothing I can notice it is softening. I think it is must be the mana, regenerating. I am regenerating, or I hope another 2-3 months my vigorness and my youthness will be reinvented, rejuvenated, and I feel that something more is required and be in touch with the hospital.
I am a retired police officer. I am 60 years old. I am suffering from diabetic retinopathy. I am insulin dependent sugar patient since from 15 years. Dr. Sunita Agarwal, they give me treatment very well, and she has asked me to take mana treatment. So I am taking mana treatment since from 1 month. Now I feel much better compared to my previous history. I hope now my pancreas will be regenerated and it has producing insulin. So my routine activities is very much better compared to my older.
What really made us happy was that we had scientific facts over here. I mean, it's not like we're trying to tell people that this is a magic potion, take it and wonders can happen. No, it has a lot of scientific background, and we had scientific papers to prove it, and this is how it is. I mean, we could give you a number of cases. Pancreatic cancers, yes, we have this lady, and initially she would come along with 2-3 relatives, you know, a lot of sympathy, and walks in a great pain, and morphine tablets. And slowly we saw those 3 relatives became 1 relative, and now she just walks in, takes in her injection, and she walks out. I mean, it feels nice to know that this lady doesn't need sympathy anymore. You know, and now she's being treated like an ordinary patient. And that's what a patient wants finally. You know, to be treated as an ordinary person. Nobody wants to be treated with sympathy and pity. Nobody likes that anymore. You know, it's like one needs to be treated as an individual, a healthy individual.
Though mana is called a magic potion, at our center we had to prove it to the scientific world. And how did we do this? By individually assessing each patient of his blood contents and his other parameters. For example, diabetics. We tested their blood sugar before mana treatment. For our amaze, we found that the random blood sugar, which used to be 350 and 400, reduced to nearly 150, and their anti-diabetic medications could be reduced in dosage, which was a very great benefit for the patients in terms of economy as well as the number of dosages that the patient had to take. We also had another patient with pancreatic cancer who was on anti-inflammatory and anti-pain medicines, namely morphine, for a long duration. And with this starting of mana treatment to this patient, she stopped, in fact almost stopped taking this morphine medicine and its side effects. There was also a decrease in the chemotherapy agents used and the duration as well as the dosage of the chemotherapy agents. We thus treated also other cancer patients with who had renal cancer, patients with lung cancer, and patients with throat cancers. This apart, we've also treated patients with hypertension who are on the end stages, who are on dialysis, and all the pre-mana injection levels of blood investigations have all proved to be on the much better aspect when compared to the pre-mana treatment therapy. This only goes on to prove that with time, mana is going to hold the center stage, in the sense it is totally natural, just like the nature which gives so much energy to the human being. So does mana, which is totally natural with no chemicals in it. This way, mana is also going to prove that it has only benefits and no side effects.
What's the most beautiful part about mana is, it is from India, it is by India, it is for India. So many years of slavery has made the world's concept of India very different than what it was, say 2000 years ago, when there was Nalanda University and Taxila. India was the Sone ki Chidiya. Well, what happened? The slavery? I don't think so. We're going to change that. We're going to change that scenario. Mana has everything in it that can change the people's concept of what medical essence is in India. We already knew dedication, devotion, dynamism was all there. It was all just subdued for so many years of slavery. It's not anymore. We are coming up, we are branching forth, and mana is just going to give that little spot into prominence where medical essence is concerned.
Manna is here to stay. Manna is here to transform. Manna is here to remove pain. Manna is here for the world, and the manna effect shall echo down the corridors of time.